This is Mr. Neil Wrighter, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with blocked earwax in both ears, and they have very narrow and bendy ear canals. The left ear, which is the ear that we're performing the procedure in first, that's the more blocked out of the two. And you can see the endoscope's just positioned at the entrance. So the iClearscope is the wireless endoscope developed by Clearwax, and that's what's used to visualise the inside of the ear whilst removing the earwax. And it's the outer part of the ear canal, the cartilaginous portion, that houses the hair follicles. The inner 2/3, the bony part of the ear canal, there's only a thin layer of skin, less than 0.1 millimetres in thickness, coating the bone itself. So therefore, there's no hair strands there, or there shouldn't be at least. And you can see the wax plug is quite impacted, and the ear is really, really bendy. You go into the ear, and at the second bend, which is about 1 centimetre into the ear canal, the ear really veers off to the left, and at the bottom of the ear canal, there's a valley there at the base, and that's where the wax is getting clogged. And you'll have a better view here. I'm just going to go back in, and hopefully you'll see just at the bottom of the screen there, you can see the ear canal narrows, almost like a V-shaped here. And I suspect, as this wax is trying to migrate out of the ear, it's getting trapped here. And you can see there's a lot of dead skin underneath as well. So this wax plug, especially at the base, at the bottom, it's enveloped by a lot of dead skin. They had been using a bit of drops prior to coming, and it was hydrogen peroxide drops. It's actually made the wax a bit mushier, a bit more sometimes difficult to remove, if truth be told. Quite often now, apart from a select few patients, I generally advise patients to attend without using any drops, and I can use the drops myself if need be during the procedure to the correct proportions. And so we're just trying to bring this through the narrowing. So this part of the ear canal, the second bend, is really, really narrow. And I'm just trying to gently wriggle this outwards. And I'm going to try and do it in one single piece, if possible. So you've got to have a bit of control over the suction probe here. If you make sudden, quick movements with the suction probe, sometimes you just break up the wax, as opposed to bring it. So eventually you will remove it, but it's always more satisfying, but also quicker and more efficient if you're trying to remove this in one single piece. I've just put a bit of olive oil spray into the ear just to lubricate the ear canal wall, just to facilitate this plug being wriggled through. And also the olive oil spray has a binding effect. It binds the wax together a bit more, so it comes out in a big piece. There we are. And you can see here to the left, that's the second bend. And when we go past the second bend, the ear's really, really narrow. We're just going to mop up some of this oil in there and a bit of this soft wax, keratin at the base of the ear canal. I'm just now using a fine end suction probe just to clear that. And this endoscope just gives you a really good perspective how bendy this ear canal is. This endoscope is being lined and straight into the patient's ear canal. So normally, and we all got bendy ears, don't get me wrong, everyone's ears are an S-bend, but this patient's eardrum is almost at 9 o'clock. It's really to the left there. So it's a really sharp bend, in excess of probably 45 degrees to the left. So to get a good view, we have to go past the second bend and then rotate the endoscope anti-clockwise. So the tip of the endoscope's viewing towards the eardrum, just a bit of skin on the anterior canal wall. And there's just a bit there at the base. And that valley, so this is, I think, the problem area for the patient. And there's also a dip here. So not only does it narrow into a V shape, but there's also a little crater, a little cave here, a little trench. And so the wax is trying to come out, but it's getting trapped there. The skin that lines the ear canal, as it dies and sheds, it moves sideways out of the ear like a conveyor belt. And it's that conveyor belt motion that then removes any wax sitting on its surface. And when you've got little trenches like that, sometimes skin can get trapped there and it can't migrate. And that's possibly why the plug, nice healthy eardrum by the way, and that's possibly why when I removed that plug at the base and that valley, there's a lot of skin attached there. This is the patient's right ear. This is probably 3/4 blocked. I just put some olive oil spray immediately just to bind this wax again and just to help it being wriggled out of the ear. So again, that came out in a nice big piece. It's far more easier this side. It wasn't as blocked. It's just some at the entrance. And again, that's the patient's eardrum. Looks nice and healthy. And you'll see a close-up in a moment of the two plugs of wax. So just a bit of soft sticky wax. So this is more surface wax, keratin on the lateral. So when we say lateral, we mean near the entrance, posterior to the back part of the ear canal. I'm just hovering over with a fine end suction probe. If it comes out, brilliant. If not, we're not too concerned. It's not causing a blockage. I don't want to end up grazing the canal and cutting it and making it uncomfortable necessarily for the patient. Even here, we've got a lovely view of the eardrum in the distance there. Again, just using the fine end just to suction some of this dead wax, keratin that's been oiled, so it's a bit softer now. Away from the canal. And we're just coming outwards. You see there's a bit of skin there again in the base that hasn't fully migrated. And here we want to avoid clarinetting, so when you're suctioning dead skin, sometimes the skin can violently flap as you're suctioning it at the tip of the suction probe, and it emits a very loud, almost deafening high frequency squeal. So I'm just using that suction probe to almost cut it. So we're not actually suctioning the wax, we're kind of dissecting the wax off the canal. There's a close-up, so the larger lump on the right is off the patient's left ear, and the smaller lump up to on the bottom left of the screen, that's the patient's right ear. I hope you enjoyed that video, guys. Take care. Do stay tuned, I've got loads of videos. I was really busy yesterday, so I didn't get time to upload, but I will try and upload some longer videos tomorrow. I know I've done a few recently, but the last couple have been a bit shorter, but I've got quite a few good ones up my sleeve. Stay tuned.